The COVID-19 pandemic started and it went like this.
So, what happens now? Well, there's a vaccine that's 95% effective. Is waiting for a vaccine to be completely effective and enough action to flatten the curve of COVID? To answer that, let us prepare for a fashion show for model countries that have been doing a great job on handling the effects of this health crisis. First in line, we have Singapore. Singapore has been treating patients in intensive care with supplemental oxygen and mechanical ventilation. Authorities have told residents not to travel and ordered all incoming travelers to be quarantined for 14 days. Aggressive tracing and containment methods and top-notch healthcare system are essential for slowing the rate of infections. The Police Criminal Investigation Department have been roped in to conduct investigation into contacts with CCTV footage and data visualization. The government launched an app called Trace Together that uses Bluetooth technology to note down the close contact of citizens. And that is all for Singapore. Next in line, we have Australia. Australia barred entries from Iran, South Korea, and Italy in earlier March, before closing its borders completely to all non-citizens and non-residents on March 19. Authorities imposed stricter social distancing rules, limited public mass gatherings, and were urged to stay at home. And of course, only go out if it's absolutely essential. Wow, that was quick from Australia! Well, it's the smallest things that really have the biggest impacts. Up next, we have South Korea. During the first few weeks of the pandemic, South Korea had one of the largest outbreaks outside China. However, the country managed to slow down the spread of the new COVID-19 cases without any lockdowns. Now the question is, how did they do it? South Korea has one of the most excellent models for mass testing, their only way to contain the outbreak. They have tested more than 20,000 people daily at 633 sites. South Korea also enforced self-isolation. At the same time, widespread contact tracing in order to stop the transmission of the virus. South Korean leaders and medical staff use digital technology as Corona Map, which generates updates about where current patients are located and inform proactive Koreans focused on protecting themselves. According to South Korean leader Hwang Seung-sik, acting fast was the most important decision South Korea has made. And last but not the least, we have Thailand. Thailand has managed to flatten the curve over a short time. Thailand focused to look at two key indicators: the number of new cases and the number of active cases. With all of the cases recorded, there has been a 96% of recovery rate, and at the height of the pandemic, the country entered a partial lockdown. Prime Minister of Thailand, Prayut, immediately declared a state of emergency. Because of lack of funds, public health authorities did not rely on mass testing but instead had an aggressive strategy of contact tracing, quarantined those who tested positive, and hospitalizing patients with serious symptoms. They also required international travelers to self-isolate, with some being confined to government quarantine centers. The battle for COVID in the country was led by public health officials who persuaded the people to use face masks. They also employed hundreds of thousands of village health volunteers to monitor cases at the grassroots level. The Thai government announced a curfew and imposed a range of measures to deter social gathering, including banning the sale of alcohol. Thai's healthcare really is indeed well prepared. And this commences the awaited Model Countries in Flattening the Curve fashion show. Let us together be inspired to imitate the footsteps of these models. One single step makes us closer towards flattening the curve. Keep safe!